continues to spread. We keep hearing the term flatten the curve, that is to slow the spread and ease the burden on hospitals and for healthcare workers. Joining me now is Dr. Adam Kassem. He is a Toronto-based physician and he's an expert in public health as well. Dr. Kassem, a lot of people self-isolating, myself included. Some are also self-quarantining. So maybe we could start with what the difference is between those two terms.
Sure. Thanks for having me, Farah. There is a medical difference between isolation and quarantine. So isolation is actually used to separate people who are sick or ill from other healthy individuals. So for example, if you go to a hospital, there are isolation rooms. But quarantines are used for people who are generally healthy, who have been exposed to perhaps a virus or a disease, and we're trying to limit that spread by keeping them away from other people. I think practically speaking right now in terms of self-isolation versus self-quarantine, there's a little bit of an overlap. And we would like all of the rules, I think, at this point in time to be applied equally to both cohorts of individuals.
So really it doesn't matter, and that is part of that is also distancing, social distancing as they say, which I think is more actual physical distancing. And I think we were just looking at some video of people downtown who are not actually practicing that. There's a lot of people who are out and about that are being told, you know, stay home if you can. I want to talk to you about some specifics because I've been at home since Friday, since we landed from Mexico, and I was under the understanding that you can't actually leave your house even if you are walking your dog, if you're going for a run or a walk. Is that correct?
That is correct. You know, look, I have a dog and I sympathize with people who aren't able to, let's say, go and share a walk with their furry loved one. But the short answer is, unfortunately, if you're on social isolation, you are not supposed to leave your house. And that means, for example, staying at home, not going to work, not going to school. It ideally means if you have a pet, for example, to try and get a loved one, a friend, a neighbor to help with some of those errands. So staying at home is key. And we know that social distancing works. We know it works to flatten the curve. We know that it's going to be very, very key right now for the coming days and weeks to slow this epidemic.
So just to be clear, that's even if you don't have symptoms, you still should be staying at home?
So if you are under self-quarantine or self-isolation, you should be at home.
Okay, good. I'm glad we clarified that. The other question I have is about delivery, because a lot of us are getting Amazon deliveries, a lot of us are getting, you know, food delivered and that kind of thing. Is there any concern about what we're letting inside our house? Should we be Lysoling everything down? How should that work?
So I think the risk of getting COVID, let's say from the mail or from a delivery, is probably pretty low. But as you're alluding to, it perhaps is a very good thing to have some precautions. And so, for example, in my household, we're doing kind of what you were just alluding to. So, for example, if we get delivery, we're taking all of the food out of the containers and putting them into our own plates. We're making sure we're disposing of those delivery materials appropriately. We're making sure that we're washing our hands with soap and water for at least 20 seconds. Other things that we're doing, we're Lysoling, let's say, the countertops, doorknobs, handles. We're also, for example, making sure that if we're entering our home, we're taking off our clothes and putting them straight into the wash. And so simple things like this can go actually a very long way.
Okay, Dr. Kassem, thanks for your insight on this.
My pleasure.